Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm with my colleague, Dr. Johanna Richy. Hi, Joe.
Hey Jeff, how you doing?
I'm doing fabulous. I'm ready to get back to work after the holidays.
Yes, routine is good. It's nice to have little breaks, but structure and routine are good.
Absolutely. Well, we're going to have an all Arizona College of Podiatric Medicine podcast today as we welcome Dr. Tanya Thoms to Dean's Chat. Welcome, Dr. Thoms.
Thank you for having me.
Oh, thanks for joining us today. Funny story, background story. Every once in a while, we have a guest that has to cancel at the last minute. And Dr. Thoms was kind enough to jump on board today because we've been talking about it for a few months. So we
And our
Yeah,
students have been asking. They want to hear Dr. Tom's story. So I'm so excited.
Oh, me too. And so in Dean's Chat tradition, we want to go first names. Is that okay with you, Tanya?
absolutely.
Tanya, Joe, and Jeff. All right, sounds good.
There you go.
Let me give you a little more formal introduction, Tanya. You graduated from UC Davis, and I might
I
add that
did.
we've gotten a lot of students over the years to come to the Arizona College because of that connection. Thank you. Then you went on and got your podiatric medical degree at the California College of Podiatric Medicine. Both of us are alma mater of CCPM. You did your residency at Madigan Army Medical Center and the VA Medical Center at Puget Sound. You followed that up with a fellowship for 1 year, Diabetic Research Fellow. You followed that up with 2 years of private practice in Nevada and then joined the Arizona College of Podiatric Medicine in 2006. Currently, Tanya is the Director of Curriculum and Student Learning Outcomes, which we'll learn about a little bit more in a few minutes. You are Associate Professor. You're the Curriculum Committee Chair. Nothing happens in our curriculum without Dr. Thoms putting a stamp on it. So, Tanya, thanks again for joining us.
Absolutely. Thank you for having me.
All right. So let's get started. How did you find out about podiatric medicine and what led you to the California College of Podiatric Medicine?
So the long story is that in high school, I had to take a 200 question test or something on a computer, like very, very old computer at that time. And it popped out some professions, and I had to spend a half a day with a professional, and I picked podiatrist. And when I went into the office, the podiatrist that was local to Half Moon Bay had I believe he was like 15, 16-year-old male with a really nasty, infected, ingrown toenail, pus everywhere. It was awesome. So he took the nail off, and I was hooked ever since. I kind of forgot about it after college, and I worked for 4 years in biotechnology as a research associate. And then I decided to do podiatry, and that's where it all stemmed from.
So when you took that 200 question test, if you weren't
Mhm.
in medicine or professional, what were the other options they gave you?
There was some like lawyer and politician and some other things like that. Writer, I think, was in there too. So
Well, that falls right in line with heading up the curriculum.
I'm like,
yes,
I,
it
I
does.
can I can see little boxes on how you could like spider web content map that.
Exactly. And I mean, it had a list of five or six professions, and I don't remember them all, but I remember lawyer was on there and podiatrist. So you wouldn't think that it would pull out specifically podiatrist, but it did.
Yeah, interesting.
That's
Hmm.
interesting. And then California College was a natural extension then for you.
Yeah, I went to undergrad at UC Davis, and then I was working in biotech in the Bay Area. I was already living in San Francisco. Actually, at the time I applied to school, I was living in Sacramento with the vet vaccine company that I worked for. And so it was a natural fit. I didn't actually apply to any other school.
So poor Joe, whenever I interview guests that went to the California College, I go down this reminiscing road. What do you remember about the California College, about the curriculum, about the professors? I have nothing but warm fuzzies over it. I don't know if you have the same.
No, I do. I actually, my class was unique because it was the first year that they had combined Turo, the osteopathic medical school. So all of our basic sciences actually was combined with osteopathic medicine for the first 2 years. So that was a little bit different in terms of the history of the California school. But I loved the professors, and I loved obviously I love biomechanics with Dr. Shear, and he since passed away, which is unfortunate for our profession, but he trained a lot of us, and we carry that through for our current students.
Absolutely. We didn't touch on the biomechanics, but California was noted for sports medicine, biomechanics, and kind of pushing the envelope in
Yes.
terms of the lower extremity and the function, normal and abnormal function of the lower extremity. So you carry that
Yep,
on with you.
absolutely.
Can you
I
share?
try to.
Well, you do. You do a heck of a job. Can you share with our audience kind of our biomechanics curriculum? Not in like syllabi detail, but you know what I mean.
Right. So we basically have a year's worth of biomechanics. The first 2 years is your basic joints, normal, abnormal joints. And then we move into the last one, which the students really like because we do case-based. And so we work up 4 to 5 cases that the students have to view actually videos that we developed for that were actual patients, and they view those, they look at all of the biomechanical exam, and they develop a orthotic prescription. And then from that, we discuss everything. So they're really trying to then synthesize material that they gain from biomechanics, as well as sports medicine and podiatric medicine, as well as our surgery courses, to kind of bring it all together and to work up that case.
Very good. Joe, do you remember the biomechanics curriculum here?
I do, but it was different. There were differences than there are now, which I think is a wonderful progression of the field. And it's been really fun to come back and have the opportunity to sit through lecture again with a completely different set of experiences, a totally different lens than the student perspective. And it's fun to talk to the students about it, and when we're excited about it, they get more excited about it. And I really appreciate that one of the things that even when I was so Dr. Thoms joined Midwestern when I was a second going into my third year. So I only got a little bit of my exposure to Dr. Thoms, but she was the cool, young, new professor. Like she had just come out of, or not just, but relatively just come out of fellowship. So she was all about evidence-based medicine. And like, it was really neat, or at least for me, I will only use I language, that I felt very connected to her because I felt like I could see myself for the first time as a student. We didn't really have that role for another professor. And so, and again, just to share my fun little personal memory, is when I found out that I was going to go to San Francisco for residency, I was really nervous. Like I had moved away from home before and come back, but this was really different because it was much further. I'd never really been to this city before outside of going for the trip. And she took the time because she had lived there. And so she talked to me about different restaurants and drew me a map of the Bay Area, where the bridges all were. She told me how the BART worked. And I know it sounds so silly, but like these were things that like made a huge impact. And so it's fun to have a whole different relationship now, but just some little fangirl moments from a student.
I love it. So Tanya, I have a couple of questions for you about biomechanics. So, our students come in and they're wide-eyed and they're so excited and they're getting into the curriculum. How do you introduce biomechanics to them initially to kind of pique their interest and get them excited about it?
So we do try to, the beginning part of biomechanics, unfortunately, I say this unfortunately, because we have to bring physics. And Joe does an awesome job bringing in the physics and the kinematics and kinetics. And that's a little bit harder because it's more dry. It tends to be more dry material. Students are like, oh my gosh, I'm going back to physics class in college. And that's not what they want to do. So I do try to bring in clinical cases. I try to show them that how this eventually is going to affect them with their clinical patients, with hallux limitus, hallux rigidus, bunions, and try to relate the beginning things or the beginning joint discussions with clinical relevance. Biomechanics is one of those ones that's very three-dimensional. So either students struggle in the beginning, and then you see the light bulbs kind of go off in their second and third years, and sometimes fourth years, or they get it right away and they love it because they're very mechanically inclined. Those that are mechanically inclined love biomechanics right from the get-go. And them, I don't need to sort of stimulate and help along. But those that struggle to see that three dimension, they take a little bit more one-on-one education with. So
What are some of the?
I don't know if that answers your question.
It does, but it gives me more questions. So what are some of the concepts, Tanya, that you teach that you do see, boom, the light bulb goes on? Just as an example.
Yeah, as an example, I would say that what I try to do, which has helped a lot, is I will do the lecture, and then either that same day or the very next day, they get the lab. And when they start to do the hands-on and see how to actually measure some of those joints, like subtalar joint or mid-tarsal joint, then they actually can see three dimensionals because they're working with their hands and they're understanding the lecture material with the labs. So I really do have it subtalar joint lecture, subtalar joint lab. And I have them back to back because I found that students grasp the concept better.
Well, everybody's a different type of learner, right? There's auditory learners,
Yes.
visual learners, and hands-on learners. And biomechanics is very hands-on, the foot and moving the foot through its range of motion and understanding concepts. It's not an easy jump.
No, it really isn't, which is also why the students get a skeletal foot model. I allow them to use that on their exams so that if they want to look at the joints and open the joints and kind of see how they move with the bones, they can do that on their exams as well. That foot model really does help to make it three-dimensional.
For sure.
And she uses a lot of videos. And I think that's another one because, again, it's a very abstract, three-dimensional, multi-unit movement concept. But then there's also a whole nother language that you're learning. Like what is inversion? What is eversion? What is pronation? What is supination? And so I love how Dr. Thoms in the syllabus has this kind of broken up lecture reinforced by lab, but then has access where the students can watch these videos as many times as they need. She'll use them in lecture, which is great because as you're teaching a concept, they can see it, but it may not be making that connection on the spot. So when they go back and review, having access to those videos is invaluable. And so again, using all of these different ways to teach multiple different learning styles. And anytime there's questions, I mean, she's amazing to go in and just sit in her office. And I still to this day will be like, can I come talk to you about, like, I have a question about this that I'd love to run by you. And having the knowledge and expertise to be able to take that question and actually sometimes realize the real question that the person is asking and not the one that you think that you're trying. And it's wonderful.
I like
Thanks,
that.
Joe.
Yeah.
So it's a 3-course series in biomechanics, and I just love the way they meld into the surgical curriculum and the overlap. I think we've done a good job with the curriculum making that happen, which is a great segue into your role as the director of curriculum and student learning outcomes. When we're developing curriculum and making changes in the curriculum, Tanya, you're very adept at looking at the big picture and how courses fit together in the quarter system. And I know that when some very difficult questions come up during our curriculum meetings, all heads at once turn to you. So what do you attribute that talent to? And you're really good at it.
I think really what it is, it's institutional memory. What I mean by that is I've been here over 18 years now. I've seen the curriculum change. I'm very good at having not really photographic memory, but I really see it in that sort of photographic outline of the curriculum. And I've been here long enough that I know those changes and I remember the changes. And so really it's that institutional memory. And I know what the students have been asking for over the last 18 years and how we've been making those changes. And so I think that does help is that institutional memory.
I'm with you. I think that's very gratuitous to that. I mean, that's natural, but still, you have a talent for that. And I think one of the biggest challenges, Tanya, is that there's more and more information. I mean, pharmacology, for example, can be used, but whether it's all surgery, for example, you still have the same amount of time to teach a course that has really branched out over the years. I'll just use a typical example, MIS surgery. I mean, it's hard to put all of this information into a finite period of time. And we seem to have done it very, very well.
And I think so. I think part of it is that things get refined over the years. Our questions get better. We are more, we're starting to look at application questions, and that's starting to change our curriculum as well. But I think we definitely have the time in our curriculum. We also have made a concerted effort across basic sciences as well as podiatry to get rid of redundant information. So that has actually unloaded the curriculum as well, is that redundant information. So, like for instance, we have a new pharmacology course director. And so he's been revamping a little bit, trying to get rid of some redundancy in pharmacology. It's the same thing that we do with all of our courses.
Yeah, we've taken out as we've added, we've also taken out the redundancy the last few years, and we've reshaped
Correct.
the med curriculum, the pod surge curriculum. There's no such really thing as status quo. Things are changing all the time.
All the time. Yep. Well, and with new evidence-based medicine. Now, I will say with biomechanics, there's always new research coming out, but what I teach them is root theory for their basis, to give them that foundation, so that once they go out onto rotations and they read other articles, they have a foundation by which they can evaluate those articles. And I think that happens with most of our podiatry courses, is we give them the foundational information, so they have that, and from there they can then judge new research or new techniques that have come out, new products that have come out.
No, that makes sense. Joe, your thoughts?
Yeah, and I think that idea of really teaching the principles and the fundamentals of something, because to your point, Jeff, things are going to continue to change. That's actually one of the most exciting things about medicine, and podiatric medicine being no different, is that things will continue to evolve and change. And if you understand the fundamentals or the basic principles of something, that doesn't change. Everything else around it does. Or how does this make sense with what I know about the function and the form of the foot? Those things don't change. And so if our students can walk away with a really good grasp of that basic foundation, they're going to be successful.
Absolutely. So Tanya, what do you think are some of the challenges we're going to have in the next few years from an educational perspective?
Challenges facing us definitely is going to be recruitment, right? We want good quality, high quality students. We want students that are motivated for healthcare and interested in helping people. So I think that's going to be, in terms of education, our biggest challenge really is to find those good quality students that are interested in medicine.
I agree. So this is a fun discussion because we're always talking about admissions and different parameters. And for many, many years, we could look at MCAT scores and science GPAs, and we could predict how they would perform. But I think even with COVID throwing a little curve into the situation, nowadays, passion for podiatry, we expect them to have the requisite brain power to be successful, but they also have to have minimal distractions. What in your eyes is the perfect candidate for podiatric medical school?
That's a tough one.
I told you to be easy questions, but I threw a curveball at you.
That is a tough one, because I think we can't discount motivation for medicine, motivation for podiatry. So those students that we would expect sometimes to struggle because their GPAs and their MCAT scores aren't as stellar as we want them to be, they do phenomenally well. And then some students that have great scores, they don't do as well because when they get here, they get a little bit lost, or they just, other things come up like family. So I'm not sure what makes the best candidate, but I will say somebody that has grit, that is there to do what it takes to get the job done and be motivated and really want to make a difference in patient care.
That's kind of a common theme in our top students. I'm with you completely.
I have a piggyback question, Jeff, if you don't mind.
For sure.
When you've had students in your office that maybe are struggling, what are some kind of key pieces of advice that you find are useful in most settings, like kind of common things being common? What do you find as something that you hear yourself say a lot for students?
So I think what happens a lot of times is these students that we get, they've done well in undergraduate school. And so they're not used to failing an exam. And they just get so heartbroken and upset with themselves. And they think that they are disappointing us as their faculty. And so I tell them that they're not disappointing us. They can do this. And really, it's telling them that they still can do this. And even if they have a failure in an exam, doesn't mean they're going to fail a course. But they also have to not dwell on that exam. And that's what they tend to do. They kind of revisit that exam. They're in the middle of the night going, oh my gosh, I failed that exam. I'm going to fail my next one. And that's where they have to get over that. And I just, basically, I'm their cheerleader, is really what I try to do. I try to communicate with them and say, hey, if you need me, I'm here for you, but I know that you can do it. And that's really what I try to get across to the students is we wouldn't have invited them to be a student with us if we didn't think they could succeed.
Yeah.
And I know that every one of them can.
I love that. And we'll touch a little bit on some sports stuff later, but certainly in sports psychology, that's such a huge part. The mental game is just as important as the physical game. And I think that that's a really fantastic analogy for medical school is you just have to shake it off and start over, like just keep going, like just keep one foot in front of the other and not let it really mentally shake you. And that's very easy to say and much harder to execute as a student. So I appreciate that that was something that's not actually what I expected to hear you say. So I love that that was because I think that that's such a universal thing. And so even
Mhm.
pre-med students that maybe are stumbling upon the podcast for the first time that are going through that in their undergrad and like, oh, maybe I don't have what it takes to be a doctor because I've failed physics, right? It's okay, right? We've cultivated this group of perfection type A obsessive compulsive humans that little tiny setbacks are just devastating, but that doesn't have to be the end. So learning how to just shake it off and pick yourself up and just keep moving forward is a lifelong lesson. I'm struggling still to this day, but it's
How
I
many
do the
times?
same thing. Still do it.
yeah.
It's funny. I can't even count how many times I've told a student who is struggling in one way, shape, or another. It's just a bump in the road, right? It's just a part of the process, and just like you said, just keep your nose to the grindstone, one step at a time. That's just the best advice you can give. Because, like you said, Joe, we wouldn't invite them to come here if we didn't think they'd be successful.
Exactly.
All right. So, Tanya, I wanted to talk. And anything else, Joe? You want to talk academically?
No, because I want to talk to her about the sports medicine stuff.
Yeah, me too. Man.
Maybe not sports medicine, but sportsy stuff.
Yeah, let's talk about martial arts.
Yeah.
Can you give us a little background?
Martial arts.
Well, is it Taekwondo, Judo,
No, it's Kung Fu. It's
Kung Fu?
Shaolin Kung Fu.
What kind of Kung
Mhm.
Fu?
Shaolin,
Okay. Well, I said martial
Shaolin Kung
arts
Fu.
because I couldn't remember that.
It's okay.
Give
Most
us-
people don't. Most people, the known thing is Taekwondo or karate, but this is Shaolin Kung Fu.
So this is so fun. Share with our audience kind of your history in Kung Fu and how you've progressed through the ranks. I don't know anything about it, so I can't even do justice to it. So the floor is yours.
Okay, so about 7-ish years ago, I decided I wanted to formally learn how to do Tai Chi and start off with Tai Chi. And where I went to the studio, they do Tai Chi and Kung Fu. So I was doing Tai Chi for about a month, and they're like, oh, you'll love Kung Fu. You have to try it. And so I did, and I got addicted to both Tai Chi and Kung Fu. So I do both. When you look at martial arts, Shaolin Kung Fu actually came originally from India, and then the Indian actually brought it to the Shaolin monks in China, and that's how it developed. Tai Chi is just another form of martial arts compared to Kung Fu. And so what they usually say is you start with Kung Fu on one hand and Tai Chi on the other, and in the end, they come together when you're really good. And it is very true. I'm finding that my Tai Chi helps my Kung Fu is helping my Tai Chi. So that's what I started doing. I do have my black sash in Kung Fu. I also am a instructor of Kung Fu. And so I teach little kids and I teach adults. So it's a lot of fun. And I'm finding it's fun for me because there's a lot of biomechanics involved.
So what does a black sash mean exactly?
The black sash really, I mean, truly means that I'm just now starting to learn how to do Kung Fu.
Oh my gosh. But that's
So you
still,
go from
oh,
white sash through,
yeah.
yes, the black sash is about, I think I have 11 sashes prior to the black sash. Um, and so my black sash is my 12th sash so that would be my 12th rank test. But I have to say that the other sashes, they're really, like we talked about before, it's the foundation of how you move and how you generate power and how you do certain things. But once you get to black, that's when you really learn how to do the movements and generate power and make things actually work.
Kind of like the more you know, the less you know. Because you're just
Yes, yes.
into,
And it's crazy. Yeah, because he'll change the position of your heel just like a quarter inch to this one other side, and it makes all the difference in how the movement works because it changes the alignment of the body and it changes actually how the energy runs through your body. It's just extremely fascinating.
that's wild. Joe, your thoughts?
Yeah. So I knew that Dr. Thoms did Tai Chi.
Kung
I almost
Fu.
said Taekwondo. And but I had no idea that she was an instructor. So like this was a game changer when I found this out this morning as we were talking about this. So I'm so curious, as you have been going, so it's the last 7, 8 years, being a student as an adult learner, has that changed your perspective of how you teach?
Yes, actually. Um, so it changed it because sometimes when you're teaching, you make assumptions that students understand what you're talking about and what you're doing. And I realized being a student of Kung Fu and Tai Chi that I'm like, what are you talking about to the instructor? And understanding, wow, sometimes you assume the student knows what you're talking about and understanding, and they really do not. And so trying to come up with other ways of saying the same thing is really what I took from that. So, for instance, we'll say at the Kung Fu studio all the time, this is my analogy. If it works for you, great. If it doesn't, forget about it. Because there's this one movement that you can do with creating energy. And it's basically, I'm like, if you think about vomiting, I know that seems weird, but you kind of like vomit, and that actually brings this energy up. And so I tell people, think about vomiting, and that's how you generate that energy. And if that doesn't work for you, then don't use it. So that's how that's changed my teaching in biomechanics is now I understand that I may need to show a student multiple ways on how to grasp seeing inversion or eversion of the calcaneus. Versus before, I was like, well, you should be able to see it because it's right there. But now I understand that sometimes it takes different ways of understanding for the students. If that answers your question.
Yeah, completely. And that's where I find it so fascinating because as I have been a student for my whole life, when I started teaching, you really start to realize where the disconnects are. Because to your point, like I'm saying the same thing and you just keep saying the same thing over. Like, well, here, let me try it a different way. But you just keep saying the same thing and you can see the blank look. And so to have to know the material well enough to think about it in a different way really takes an expert level to do that. And so I find it so interesting when I talk to people that as an adult try to learn something new or take on a new task or skill, because, and again, I will only use I language now, as I have tried to learn things as an adult, I am not nearly as open to making mistakes. I'm not as comfortable being bad at something or being really embarrassing at it. If like looking really stupid, like, right, like those are the things that are now like barriers. And so that mental part, again, to go, not to draw all of the analogies, but to go back to your thing about where sometimes students really struggle, it is kind of the same phenomena. They are just in a different realm of dealing with it. And so I find it so interesting as an adult learner to have to just get comfortable being uncomfortable. Like you just have to let it go. If you're going to learn how to do something, you have to embrace it being terrible at it in the beginning. And as you've been going through learning something as intricate too as Tai Chi and Kung Fu, have you found there are certain things that kind of trip you or that you have had to like reframe to let yourself move forward, if that makes sense?
It does. And we were talking about this earlier, how if your mindset isn't appropriate or isn't positive, then you can't actually do it. Especially in Tai Chi, we do this thing called push hands, where you're actually feeling other people's energy and you're trying to work with the other person. And I'd be like, this isn't going to work. I know this isn't going to work because I can't do this. Well, then I couldn't. I actually couldn't do it. Or we're working with energy and I'm trying to do a certain movement with energy. I'm like, this isn't going to work. I can't get this to work right. And then it doesn't. But if you think, oh, it is going to work, then all of a sudden you're like, wow, I barely moved and it completely worked. So that's we're talking to the students too and helping them saying, you have to put that failed test behind you because if you think you're going to go into your next exam and think, oh my God, I failed my last exam, I'm probably going to fail this one, you probably will just because you're so nervous and you've put that energy out there that you're going to fail. And so I've struggled with that in Tai Chi and Kung Fu, absolutely. Also feeling silly doing a new movement, learning a new movement, that the students do that with biomechanics, learning how to manipulate the subtalar joint and learning how to do the measurement. They like, I feel stupid doing this, so I'm not going to do it. And then they never get good at it either. So practice makes perfect. And practicing perfectly makes you even more perfect.
Tanya,
I like that too.
I like that a lot. Tanya, and maybe this is a simple question, but maybe it's appropriate. What percent of Kung Fu and Tai Chi is physical and what percent is mental? Yeah, I don't know. That's a fair question.
Yeah, so I would say that I'm going to have to say 50-50. I know there's probably people who are going to disagree with me. That's okay. And the reason why I say 50-50 is most of the movements are physical, but if you don't mentally know what you're doing, it's not going to work. Or if you don't, um, yeah, if you're mentally not like if you're, and what it is, it's focus. If your focus is off, it will not work. For instance, there's some movements that if you focus on your hand when you're blocking somebody striking you, if you focus on your hand, the block will never work. You have to focus on your elbow. And so changing your focus, which is mental, has a huge impact in Tai Chi and Kung Fu. So I'm going to put it at 50-50.
You know, it's funny you mention that because one of the best shooting instructors in the world says 50-50 also because he said it doesn't matter how strong your mental game is if you don't have the physical skills or the foundation, if you will. And once you have that, then you got to layer the mental game and the focus and the control on top of that. So that makes sense to me.
Yeah, and absolutely. And that's what we say too with Kung Fu. You have to be able to do the physicality. If you can't squat to the floor or you can't do push-ups, then you don't have the upper body or lower body strength in order to do some of those movements. It's just not going to happen.
Fair enough. I like that. Joe, any other thoughts on Kung Fu and Tai Chi?
No, but I can see so many little analogies to
I agree.
school. You can see my little like wheels turning. Like you have to have the foundation, the skills, the physical ability to get through the content. But then so much of the shift starts to be mental. And and residency, I think, is a very fair, like very much 50-50, right? The physicality of it, of just being able to do all the things that you need to do, learn all those technical skills that you are learning in terms of how to use your hands and your body and the work that you're doing. But then there's so much too that really is that mental game. And depending on different programs and how they interact with residents, that can look very different. But it's so interesting, like to hear you talk about how you teach biomechanics, how you have learned Tai Chi and Kung Fu, and then now also how you teach Tai Chi and Kung Fu. I keep wanting to say Taekwondo, and that's not the right thing. So I apologize that I'm getting all the words wrong. But I think it's just so interesting that there are these common threads through all of these things. And it's just really interesting pulling those little like nuances. Have there been things that you've noticed as you're teaching students something like Tai Chi skills and then teaching students something like biomechanics? Are there big differences or are they pretty similar as you've started to perfect your teaching skills in terms of how you interact or reinforce or teach concepts?
I would say that the way I teach is probably very similar. Um, but I don't know, but the content obviously is completely different, right? Biomechanics, when we do things, and that's one thing that I had to learn differently with Tai Chi and what we do as a profession, we're very hand centric. Everything is the hands. We move the hands. The hands just go all over the place. In Tai Chi and Kung Fu, your body is connected and your hands do not move independent of your body. So that's a very different concept that was very interesting for me to learn because we're all up here, our energy's all up in here, and because we're type A personalities, and so we all live in our head and our hands. But in Tai Chi Kung Fu, everything goes down to the feet and into the belly in terms of stability and being centered there versus up here. So that's something that's very different from those two kind of aspects. I will say, though, it has helped me because when I have students that are nervous for exams, I talk about grounding themselves and breathing into their belly and making their feet more heavy. Because what that does is it takes all this excessive energy that's in your head and heart and it brings it lower down, and it actually calms you and slows your heart rate down. So I have used those methods in students that are struggling on exams and get nervous for exams. So I guess I am utilizing more than I think I am.
Yeah.
I've got a couple questions, but I'll ask you in the office tomorrow about the hands and the body and function. Instead of going like this, you can go like this and have
Correct.
more control.
Correct. You should always keep your shoulders and your hips stacked on top of each other. They do not move independent of each other. Your hips and shoulders always move in the same plane, and therefore your hands move in the same plane. So actually, when I was learning Kung Fu and Tai Chi, as I was at home making dinner or whatever, cleaning, I started to make my hands follow my body instead of my hands being independent of my body. Yes, absolutely. And you have much more stability and decreased falls risk when you actually do that.
Absolutely. And I think that carries over to other sports too. With
Yes.
apologies to our listeners on Spotify and Apple, we're doing all these movement things here. I'm with you, totally with you on that. Okay, shifting gears just a little bit, Tanya. You have a new hobby.
Yes.
And now you're a pending pilot, I understand.
Yes, so I am learning to become a gyroplane pilot. Yes, I'm in the very beginning stages. Talk about mental and physical. Um, lot of mental in the beginning, a lot of physical, and it's exhausting, but it's a lot of fun. I have yet to solo. I'm hoping this next month or two I'll get to solo, but I have about 20 hours, and it's a gyroplane, which is a cross between a helicopter and a fixed wing airplane. I got sold on it because they're relatively safe to fly if you're going to fly an aircraft, but it is so much fun. Just so much fun to do the gyroplanes. Yes.
And see, this is so
So,
interesting, Jeff, because we've had Stephen Barrett and Jamie Meares, who were also pilots, and both of them had commented at when they went through, and again, as adults, went back to learn a new skill, the way that it just completely changed how they looked at how we learn and how we teach someone to do something. So I'm really excited to continue to ask you more questions about adult learning.
yes, and actually, the eventual plan is for me to get certified to teach gyroplane piloting. So that's my eventual goal. Because, you always have to keep things. One of the ways to stave off Alzheimer's and dementia is to basically do a mental activity that also includes a physical aspect to it. That's supposed to be the best way to do that. And, I'm all for that.
That's fantastic. All right. Well, we're going to follow you through that journey too. And next time you're on Dean's Chat, we'll discuss piloting.
Well, we might be able to do it live in the gyroplane.
Oh,
Oh,
now
live
you're talking.
stream.
Now you're talking.
Yeah. Wouldn't that be cool?
How many people can you fit?
Just two. So a pilot and another person. But the plan is to have some cameras in the gyroplane for filming for YouTube.
Oh, that's awesome.
So
Hmm.
we're gonna have to do like rock, scissors, paper to see who gets to go on the plane and who has to be in the studio.
Oh,
All right,
Yes.
Tanya, we can go on this, but we can't finish this interview without doing some quick hit questions.
Right.
Favorite food?
Ooh, that's a toughie. I have so very many favorite foods. Off the top of my head, right now, I have to say Alden's chocolate mint ice cream.
oh,
Yeah.
good one.
Your turn.
All right. Favorite place you've ever traveled and why?
So I like Mono Lake and the June Lake Loop on the east side of the Sierras, on the east side of Yosemite. A lot of history for me there with going there as a kid and then as an adult, and it's just one of my favorite places.
June Lake is absolutely breathtaking. I
Yes,
can I can
yeah,
imagine.
especially when you go over O Ridge and see it for the first time. It's just incredible. It's a beautiful glacier mountain lake, and it's just gorgeous.
Tell us about your pets.
Ooh, I have two puppies and three cats. So they're a lot of work. Yep.
When you go camping, fifth wheeling with them, do they go with you?
Yes.
Oh,
The
they do.
dogs do. The
Oh,
dogs do. The cats do not. Yeah. The cats and dogs don't always get along very well. So,
so what's the biggest challenge of going on a camping trip with a fifth wheel?
um, finding enough time to go everywhere I want to go.
That's a good answer. I would
Where's the next place you do want to go?
We haven't decided on anything yet for this year. Usually in January, we start the whole list throughout the year. I still have Bryce Canyon on my bucket list because I didn't get to go last year because that trip got canceled. Um, uh, so that's still on my bucket list is Bryce Canyon at the Frida campground. It's supposed to be beautiful.
taste in music.
Music, it's fairly eclectic. I listen to everything. Probably right now, alternative is probably what I'm listening to the most.
Alternative rock, alternative rap.
Yeah, probably more alternative rock. No, probably not rap. No, sorry. But alternative rock probably is more what I'm listening to at the moment. Yeah. But I listen to all sorts of things. I like Celtic music. I like, um, guitar music. It just depends on my mood.
Do
Every
you
once in a
play
while, a
any
little bit of
music?
country, maybe.
Oh,
I do not. I tried, but I do not play an instrument. No,
Do you read? Read books?
I do read books, read lots of books. Yes.
what's
What's
your favorite thing you've read in the last 2 years
The
or year,
last
depending on
two
how much you read?
years, I know, right? I read, unfortunately, I have to say, I read a lot of trash. And I call everything that's not literature trash, right?
That's
So
okay. Great
for me,
has a
that's almost
wide
everything.
spectrum.
Yes, Wise Spindle Tribe. I haven't read this in a long time, but one of my favorite authors is Zora Neale Hurston. She's a Black woman's writer, and her characters and the way she writes it, it's in the language of how they spoke, and it's just amazing. And it usually, I think it takes place basically in the 1940s, somewhere in there. Really fun stories.
So you prefer fiction?
Yes, I have to say I prefer fiction. We have so much real life when we're working that I like a little bit of escapism. So it's fiction, yeah.
I have a question for you, going back to what we do for work. Um, what do you like more? Do you like administrative, like being the head of curriculum and student learning outcomes versus teaching, or is it both of them? Or what's your favorite thing to do at the school?
My favorite thing, actually, to be honest, is the diversity of what I do.
Oh,
So
okay.
I like the diversity. I don't like having the same day every day. I like coming in, meeting the students, which is what I did today, and then working on lectures for my course that's happening this week. Also working on curriculum, working a little bit on the new testing software that we're having to roll out for spring quarter. I like having that diversity. So I like being director of curriculum. I like lecturing. I like doing student discussions, admissions. I like it all.
Yeah, I think in a university environment, if you're an outsider, you kind of get pigeonholed. You're a professor, you just teach. When in reality, there's a whole lot of facets to our roles within the university and with the students and with each other as faculty. It is uh, just a wonderful interaction across the board. Anything
I'd
else?
agree. And we have a great team.
Oh, definitely, great team. Hey, shout out to Dr. Page. He kind of put us all together.
Yes, he
Oh,
did.
that's one of my
He
questions.
definitely
Yeah, so
did.
and I know we are a little short on time, but how did that go? Like how did you get involved at Midwestern? That was one of my questions. I got so engaged in all the Tai Chi stuff I forgot, but how did that happen when Dr. Page reached out to you?
So he was looking for younger faculty to teach, and I was in Nevada working doing clinical practice. And he reached out and said, "Hey, I want to. Are you interested in becoming a faculty member here and teaching?" He was my previous dean at the California school, and then when I did my residency and fellowship, we had put on a conference, and he had seen me there at the conference. So then a couple of years later, when I was in private practice, he's like, "Oh yeah. So, would you be interested in coming to teach here?" And I said, sure.
That's so fun.
So you
Hmm.
picked up lock, stock, and barrel and moved to Arizona.
Yes, absolutely.
Fantastic. Joel, we got to get Dr. Page back on. Maybe we'll get a bunch of the faculty and we'll all kind of reminisce just for
That would
fun.
be really fun. Yeah.
Well, he was your dean.
He was. Yeah. He recruited me too. Yeah, because well, he recruited me in the same way that I went and asked him about like in my typical stance about a million questions. Because the I was a undergrad here at the biomed program, and this was a new program that was coming to campus, and I was like, "What's podiatry? I've never even heard of it." And so of course, go introduce myself, ask him a million questions, and he had said, it'd be really good to go shadow someone, like go feel and see it for yourself, and so I did, and that was the end of it. It's like, yeah, this is exactly what I want.
I'll tell one quick tidbit on Dr. Page. I worked up my first patient with Dr. Page as a third year student. He
That's
was
so cool.
so. I mean, just go figure. And life is short and wild and crazy, and you never know where it's going to lead you.
Yep.
All right. Anything else, Tanya? Anything else that we need to know?
No, I think you pretty much have asked me most of the questions.
Fabulous. All right. Well, Tanya, you're going to have to I'll walk over to your office. I'll 10, 15 yards away and deliver a cup for you tomorrow. Dean's chat.
Ooh,
Yeah. Yeah. You know,
thank you.
you're into different types of caffeine. Yes.
Yes, absolutely.
All right. Sounds good.
Yeah.
This will
There's
fit.
coffee, yerba mate. Yep.
All right.
So we didn't ask
Guayusa.
beverage of choice. That was one of our rapid fire. We haven't asked her. So caffeinated beverage of choice.
At the moment, it is a double espresso,
Mm.
but next week it might be yerba mate. It just depends on how I'm feeling.
That's fantastic. All right. Well, Tanya, thanks for making time in your schedule to come on Dean's Chat. We've been talking about it for a long time. I'm glad we could make it happen.
Me too. Thank you so much.
You bet. And to all of our listeners out there on Spotify and Apple Podcast, we appreciate you listening, and please give us a 5-star rating. And if you're watching on YouTube, by all means, become a subscriber. And until next week, cheers, everybody. Bye-bye.